Okay, what things are most guys getting wrong when they are trying to optimize?
And if this is your first time here, make sure to subscribe so you can learn more about fitness and nutrition, hormones and anti-aging, all this to optimize your life overall. And hit that notification bell so you don't miss anything.
Okay, so a lot of what we want to discuss in this video is about that and a bunch of other stuff. It's questions that come up often in the group. It's just kind of help clarify things a little bit better for guys that are trying to get into this type of thing. So we're finding that the majority of people that are asking questions that are not quite optimized yet, they're not feeling great yet, they're having symptoms, they're having whatever the case may be. Typically, these guys are guys that are doing weekly injections. They're not doing anything nearing daily administration. They're worrying about their labs, they're worrying about numbers, they're worrying about stuff on paper. They're not waiting long enough for this stuff to take effect. So I want to answer that question really quick. I don't see how anybody can possibly be optimized by doing weekly administration. Weekly administration, you're going to give yourself your shot, or you're going to give yourself whatever administration you're using. You'll have a big peak first couple of days, and then over the course of the week, it's going to go lower, 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 lower to the end of the week that you're just really looking forward for your next dose. The body can never possibly stabilize that way. Your body is always going to be in some kind of a flux. You got to keep in mind that it's not just testosterone that is going up and down, but everything else that is being affected by it. So when your testosterone goes up, well, your estrogen will go up, and DHT is going to change, and there's a ton of other variables involved that will be affected by any one hormone going up and down. So as long as your hormones, you have one particular hormone, say testosterone, that's constantly moving around, everything around it is constantly moving around, constantly adjusting, and you're never really going to feel consistent on any given day. It's not possible. The human body does not produce testosterone once a week. The human body doesn't say, okay, well, it's Monday, let's put out a whole bunch of testosterone, and then next Monday I'll put out some more. It just doesn't work that way. The body is constantly producing testosterone. Now, yes, right now we are, if we're on TRT, it's because we're deficient or we're having deficiency symptoms. So that, but that, the body was still making some. The thing is that you want to mimic the body's natural production as much as possible. And the only way to do that is you need to dose yourself frequently. If you're doing injections, the best possible method is going to be every day. You give yourself a tiny bit every day. And that tiny bit every day, well, now every day you're going to have the same amount of testosterone, Okay, so you're starting off with, deficient. You're giving yourself some every day. So now your levels are now here. Everything else supporting testosterone, your E2, DHT, everything else is gonna now adjust to this new norm, and eventually it's gonna stabilize. And that's when you're gonna feel level. You'll feel the same. You're not gonna feel these kind of ups and downs that you do it weekly. So daily administration is absolutely key. Yes, it's a pain in the ass. I get it. It's a pain. Sometimes I don't feel like giving myself the damn injection. I'm sure some guys that are applying the cream, they don't feel like giving themselves the cream. They just want to go to bed, or they just want to wake up and they want to go to the pool or whatever. I get it. I'm not telling you this because, how can I explain this? I'm telling you this because it's the best way of doing it. I wish that we could just take, a big dose once a year and be done with it. Yeah, that'd be great. But I'm telling you that taking this every day, as much as a pain in the ass it could be, is the only way that you're going to ever feel optimized or ever feel good. There is really no other way. Yes, some guys can do every other day if they're doing injections. There's guys that say, well, I do twice a week and I feel fine. Yeah, potentially that's the case. I wonder how much better these guys would feel if they were doing daily. So daily is it's absolutely key in my opinion. Not to mention, when you're doing daily, you're giving your body a smaller dose every day, just a little hit, instead of one big heaping dose all at once. When you get that one big heaping dose all at once, the body's like, whoa, and it's got to figure things out. It's got this big dose of testosterone in the system, and it doesn't quite know what to do with it, and everything just goes haywire. Just giving this little pulse every single day, the body just kind of learns what to do with it. It keeps everything nice and steady. And that's when you start feeling better. So that's number one. Answer your question about the things that guys are getting wrong, trying to optimize. Number two, caring about numbers. I had a doctor that, try as I might, if as soon as I would start taking more and I would start to feel better, he would look at my labs. I'd sit down at his desk and he would go behind his desk and he would just look at the piece of paper and say, okay, well, your testosterone is high, your E2 is here, this is here. And somehow he believed that keeping everything in this magical range, or whatever these ranges that these pharmaceutical companies or whatever come out with, if you keep them there, that's when you're going to be optimized. It is so unbelievably far from the truth. You have no idea. Guys, you need to completely take this whole notion of a range, of a clinical range, take it, erase it from your brain, and toss it out with the trash. It is one of the major things that guys are obsessing with that's preventing them from feeling better. Okay? Why? If the range is, for total testosterone is 200 and something to now I think it's 900. It used to be 1500, but with every passing year it just gets lower and lower and lower. If you're at the top of the range and you're at 900, but you still have symptoms, what are you going to do? Do you say, well, I'm at the high end of the range, and if I go higher, all these bad things are going to happen? Or if you say, well, screw the range, let me take more and let me see if it resolves my symptoms? Typically it will. Okay, so the whole notion of these ranges, you gotta forget about. You gotta forget about going for any type of number. I need my E2 here. I need my testosterone to be here. I need my free T to be here. And you're just chasing numbers all the time. You got to keep in mind, first of all, every time you're gonna take a test, your numbers are gonna change. So if you say, well, how come my total testosterone has dropped 20 points? No. It's stuff is still gonna vary with every given test that you do. By the way, if you are doing labs, you definitely want to use the same clinic or the same lab every single time. Don't get your blood drawn from one place one time and then from another place another time, another place another time, and try to make a comparison. Because you got to keep in mind that the people that are doing this lab work are different. The equipment they're going to be using is going to be different. The way they're measuring is going to be different. The protocol, all these types of things are going to vary, okay? So there's been doctors that have sent blood work to multiple different clinics to have them analyzed. And when they get back, the numbers vary sometimes by like 30 or 40%. Okay, so you find a place to get your blood drawn and use that same place and that same test. This way here you can compare. Last time I was here, now I'm here. We use the same method, we use the same people, we use the same equipment, we use the same whatever the case may be. There's the other thing I would say, biggest thing of all, is guys that are saying, well, I'm taking 150 milligrams a week of testosterone, and I know that's a good dose. And I shouldn't go more than that, because if I go more than that, it's considered steroids. Or if I'm going into over 200 milligrams a week of testosterone, it's now we're saying we're abusing testosterone, or we're going into super physiological doses of testosterone, and we're no longer doing replacement levels. And I'm going to get to that later, of why that is just no longer the case, and that you can't think that way, and that replacement doses of testosterone, trying to keep yourself in that magical range today, is going to be a complete and utter waste of time. Well, we'll get to that later, and it has to do with EDCs. And the other big mistake that guys are making is they're simply not waiting long enough for their now higher level of testosterone to have an effect on the body. So I was trying to think of an analogy to explain this the best way possible. And I play some guitar, and I have a tube amp. I don't know if any of you guys know about tube amps or tube amplifiers for guitars, but if I was to plug in my guitar into this tube amp and I power it on and I try to start playing right away, I have no sound. Why? Because I've applied power to this thing, and now that power has been applied, the tubes, which are basically what does the amplification, if you will, they need to kind of heat up and warm up. And once they've kind of gotten to their max, that's when you get sound, okay? When it comes to testosterone, you can't say, well, I'm going to give myself a shot at 200 milligrams. So now later on in the day, why don't I feel well? Why don't I feel different? How come I don't feel it? You know, or I've been taking 200 milligrams every single week for the last 3 weeks. Why don't I feel different? This stuff takes a while to take an effect. It's not like drinking an espresso. If I'm feeling sleepy, I drink an espresso, and literally within 15 minutes, I was like, "Ooh, you know, that woke me up." It's having an immediate impact on the body. Okay, with like any type of stimulant to be the same. You know, you take a sleeping pill, it'll be the same. You take a sleeping pill, and half hour later, you're getting sleepy. It's having an immediate effect on the body. When it comes to testosterone, it's very much like this tube amp analogy, where you got to get your levels up to a certain point. And once your levels are there, now you got to give it time for the body to make use of this testosterone and for that effect to occur. You know, so almost think of it as a dimmer on a light switch. First, I got to apply power. And I got to make sure that this dimmer is actually getting, you know, power. And then I start slowly raising the dimmer, and now the light is getting brighter and brighter and brighter. And this can take several weeks, sometimes even months. Typically, after 6 weeks, you should start feeling different than you did prior to taking testosterone. But there's so many guys in the group that are saying, you know, I'm on the cream now and I'm taking 3 clicks twice a day, and it's been 3 weeks and I'm not really feeling it yet. Yeah, your levels are up. If you go get a lab right now, your levels are going to show like you've got really good levels. But those levels now have to have an effect on the body. Your body now has to start learning to make use of this. And that's the thing that takes time. Most of the guys that are still having issues just have not given it the time that it needs for it to start helping. And after 3 weeks, they're like, you know, or even sometimes after a week or 2 weeks, they're like, I still feel, let me take some DHA, let me take some pregnenolone, you know, maybe I need more dose, or maybe I need to lower my dose, you know, maybe it's the issue with E2, or maybe it's this, and they're constantly changing stuff, and you just cannot use that kind of approach at all. The approach you got to use is you want to do daily administration. Yes, like I said, it's a pain in the ass. Every other day, second best. Daily administration is best. You want to get your levels up. And after that, you don't want to touch anything. You don't want to take anything else. Don't take any natural supplements. Don't take anything. Say, I'm just going to take the test and I'm going to wait till I start feeling better. And once I start feeling better, then I can start throwing in some extra stuff. Okay, we want to optimize pregnenolone, we want to optimize DHEA, we want to optimize vitamin D. There's all kinds of things we want to optimize. Dr. Keith Nichols will agree with, probably disagree with me, and actually he usually does. He likes to give everything at once, but there is the odd occasion where a guy doesn't react well to something. Okay, if I take DHEA, I get acne. I feel great, but my back gets covered in acne. If I take pregnenolone at any dose, 3 days later, my little friend down there goes, ooh. Okay. Some guys take pregnenolone, they feel amazing. Even vitamin D has weird issues. So, you know, but testosterone makes me feel good. Testosterone will make any man feel good. There's people there say, oh, we're all biochemically unique. Yes, to an extent. We are all men. We are men because of our our testosterone. The testosterone is what makes us men. We're all going to do well on testosterone. There's not a single man out there that will not do well on testosterone. So my approach is start with that, get your levels up, start feeling good as soon as you possibly can. And now once you're feeling really good, say, okay, let me throw in some pregnenolone, only that, and I want to see how that makes me feel. Do I feel the same? Do I feel better? Do I feel worse? Do I feel better? Okay, let me try upping my dose and see, and try to figure out what's my best dose. Once that's done, try throwing in some DHEA. Oh, I'm getting acne. Okay, well, maybe DHEA is not for me, or maybe you feel good. Vitamin D, and you want to test one thing at a time. You want to test one thing at a time. You can't figure this shit out by taking a whole bunch of things all at once, because if you have a side effect or something is not right, or you're just not fit, you're not going to know what it was. Okay, so I like to just say, I'm going to get my testosterone levels up, and then I'll experiment with one thing. Try that for a little while. And when I say try it for a while, I mean like try it for several weeks. Then add in something else, try that for several weeks. And sooner or later, you'll start to see the things that you feel better on and the things you need to avoid. You know, I spent 3 years taking everything at once. I was never optimized. Went back to basics, used this approach, and it worked for me. Again, Dr. Keith Nichols says that the majority of men feel good with pregnenolone, they feel good with DHEA and all this type of stuff. He tends to give them all at once, but in case you're one of those weird guys like me, and trust me, I'm weird, my approach might work better. So that's to answer your that question there, Stephen.